Hello and welcome. This is an introduction to COVID-19 contact tracing and its basic steps. In this presentation, you should learn about the COVID-19 disease, the principles of contact tracing, the 6 steps of conducting contact tracing, and the ethics related to it. At the end of this presentation, you will observe a contact tracing interview. COVID-19 is a disease caused by a new coronavirus called SARS-CoV-2, and it spreads from person to person through droplet and contact transmission. The WHO first learned of this new virus on 31st of December 2019, following a report of a cluster of cases of viral pneumonia in Wuhan, China. To control the spread of COVID-19, interventions need to break the chains of human-to-human transmission, ensuring that the number of new cases generated by each confirmed case is maintained below 1. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Some people have no symptoms, while some have serious disease which can lead to death. The most common symptoms of COVID-19 are fever, dry cough, and fatigue. Other symptoms that are less common and may affect some patients include loss of taste or smell, nasal congestion, conjunctivitis, also known as red eyes, sore throat, headache, muscle or joint pain, different types of skin rash, nausea or vomiting, diarrhea, chills, or dizziness. Everyone needs to understand what incubation period is. Incubation period is the period between exposure to an infection and the appearance of the first symptoms. The average incubation period is 5 days, but it can be as long as 14 days. Thus, quarantine should be in place for 14 days from the last exposure to a confirmed case. Once exposed to the virus, 50% of people will become ill by 5 days after infected. Another important term that everyone needs to know is infectious period. Infectious period is the time during someone infected with SARS-CoV-2 can transmit the virus to other people. Infectious period begins 2 days before people become sick and will last throughout their illness period, meaning people can infect others up to 2 days before they themselves feel ill, particularly on the day of illness and throughout their illness period. So the point of contact tracing is to find those contacts and ask them to stay home so that they don't infect anybody else. Asymptomatic SARS-CoV-2 transmission also occurs because of individuals with infection who are never symptomatic or who experience very mild or almost unrecognizable symptoms. The proportion of individuals with infection who never have apparent symptoms is difficult to quantify because it requires intensive sampling and symptom screening from a representative sample of individuals with and without infection. Nonetheless, epidemiological evidence have suggested that individuals who never develop symptoms may be as likely as individuals with symptoms to transmit SARS-CoV-2 to others. For people without COVID-19 symptoms, the infectious period starts 2 days before a positive swab test. For most people, the infectious period generally ends at least 10 days after the onset of illness. Available data indicate that adults with mild to moderate COVID-19 remain infectious no longer than 10 days after symptom onset. However, most adults with more severe to critical illness or severe immunocompromise will likely remain infectious no longer than 20 days after symptom starts. Other indications that the infectious period has ended are when symptoms are improving, and when a patient has no fever within the past 24 hours. CDC considers a person to have a fever when he or she has a measured temperature of 38 degrees or greater, or feels warm to the touch, or gives a history of feeling feverish. How does COVID-19 typically progress? On average, once a person is exposed to a COVID-19 patient, he or she will start to exhibit symptoms on day 5 of being infected with or exposed to the coronavirus. The first week, and specifically the first 48 hours before the patient exhibits symptoms, is the most infectious because a lot of viral shedding happens. The first week of disease onset is when all the symptoms start to appear. In the first 2 days of COVID-19 symptom onset, patients have a heavy viral load, meaning they have a lot of viruses circulating in their bodies. For some people, the symptoms will occur gradually, while for others it hits all at once. Most patients will start having fever, joint and muscle aches, changes in smell and taste, and diarrhea, and the respiratory symptoms follow soon after. After 7 days, generally patients start experiencing shortness of breath, coughing, and having pneumonia-like symptoms. However, this does not happen all the time and may differ between individuals. The person who is infected by COVID-19 requires immediate action. It is important that the person who is infected have access to both medical care and social services. At the same time, we need to identify people they may have infected and been in close contact with. The public health prevention of COVID-19 aims to limit opportunities for the virus to be transmitted, which can be done by limiting contact between people who are infected and others. This is achieved through contact tracing. Before we carry out contact tracing, we need to have a good understanding on incubation period and what happens when someone is infected with COVID-19. As explained earlier, incubation period means the period between exposure to an infection and the appearance of the first symptoms. For COVID-19, the incubation period is thought to extend to 14 days, with a median time of 4 to 5 days from exposure to symptoms onset. So what happens when someone is infected? They develop signs and symptoms of disease usually about 5 days after they are infected, but it can go up to 14 days after their infection. Once they are infected, they themselves are able to infect others as long as they have signs and symptoms, which is at least 10 days. If a person has a contact with someone else on the day that they are sick, the infected person will have a 5-day incubation period, meaning after they are infected, they will develop signs and symptoms 5 days later. From this timeline, you can see that after the person develops signs and symptoms, he or she will have the disease for 10 days. So if we want to interrupt transmission and stop the transmission of COVID-19, we must find people who have been infected. We must limit the number of people that they have encountered so that the transmission chain won't keep going. As you can see here, the contact becomes infectious and they themselves are able to transmit to other people in a short period of time, and it occurs very quick. The basic reproductive number, or R0, describes the contagiousness and transmissibility of pathogens and is a function of contact rates among individuals, transmission probability, and duration of infectiousness. On average, people infected with influenza virus will infect 2 to 3 other people if everyone they have contact with is susceptible. A reproductive number of 2 may sound small. However, even a reproductive number of 2 can create a large outbreak if each infected person infects just 2 other people. So, we can stop each case from infecting even just 1 person if we act fast by doing contact tracing. Understanding how, when, and in which settings infected people transmit the virus is important for developing and implementing control measures to break chains of transmission. By stopping one transmission chain, we can prevent many future cases of COVID-19. There are a few factors that can increase the risk for infection and severity of COVID-19 disease, such as dense contact environment, difficult to contact trace and identify exposures, as well as difficulty in isolating or quarantine cases and contacts. One example is when we have a dense contact environment, like in urban areas where people live in apartments. In such situations, a super spreading event can occur and cause an unusually high reproductive number. So this is another reason why we need to respond fast and conduct contact tracing to limit contacts between people who are infected and others. Also, we can limit opportunities for the virus to be transmitted. We have already covered the basics of contact tracing, so now we will move on to the principles of contact tracing. Contact tracing is defined as the process of identifying all people that a COVID-19 patient has come in contact with in the last 2 weeks. These contacts have higher risk of becoming infected themselves, and they have a potential to further infect others who come in contact with them. Therefore, we need to monitor these contacts closely, provide care and treatment if necessary, to prevent further transmission of virus. If a person has been infected with COVID-19, he or she will be contacted by a contact tracer who is usually appointed by a specific organization, example the State Health Department or Department of Public Health. The contact tracer will identify the close contacts of the infected person. In certain situations, the list of close contacts can be gathered from a notification system. Following that, the tracer will contact the identified close contacts to inform them on what needs to be done. These contacts will then be monitored of their progress. During contact tracing, contact tracers must identify high-risk situations between the COVID-19 case and their contacts. In order to do this, first, the tracer must know the location and type of interactions, example household or enclosed settings, whereby the contact provides direct care for a COVID-19 patient in the home without proper personal protective equipment or PPE. Second, the contact tracers should get contact information of the places where the interaction between the case and contacts have occurred. This will ensure that follow-ups can be done and all contacts are identified and informed immediately. Third, the contact tracing team should develop a list of persons who had been in contact with the COVID-19 patient. Each contact should first be contacted by phone or in person to determine whether they meet the contact definition and thus require monitoring. In order to get a complete list of the contacts, details need to be obtained, such as conference name, if the exposure happened to be at a conference. Contact tracing is essential to be conducted for all confirmed cases and may be required for probable cases in the absence of comprehensive testing capacity. There are 3 basic steps in doing contact tracing. The first step is contact identification. Once a case is confirmed, an interview with the patient or the caregiver will be done by the contact tracing team. During the interview, the patient will be asked about their movements and activities and people that they were in contact with. The contacts can be anyone who has been in contact with an infected person. They can be either casual or close contacts. The second step in contact tracing is contact listing. All persons in contact with the infected person should be listed as contacts. It is important that each contact is aware of their contact status, that is, whether they are casual or close contact, and understand what it means. Close contact are individuals who are directly in contact with COVID-19 positive cases over the last 14 days. For example, they are seated less than 1 meter in public spaces such as office, classroom, place of worship, restaurants for more than 15 minutes. Casual contact, on the other hand, are individuals who have been in contact with the COVID-19 positive cases but are seated or standing more than 2 meters apart and less than 15 minutes. Each contact also needs to know the actions that they have to take. For example, self-quarantine, monitor for symptoms, and seek early help if they develop symptoms. Contacts will also be provided with information about prevention of the infectious disease. Depending on their risk, quarantine or isolation is required for high-risk contacts, and they can be managed either at home, in the hospital, or any designated centers. It is important that you know what quarantine and isolation mean. Quarantine keeps someone who was in close contact with someone who has a disease away from others. Isolation, on the other hand, keeps someone who is sick or tested positive for COVID-19 away from others, even in their own home. Once the contacts have been identified and given instructions on what needs to be done, they will be followed up or put under surveillance. Contacts who are asymptomatic and has received home surveillance order are called person under surveillance. During this follow-up period, all contacts will be monitored regularly to monitor for symptoms and test for signs of infection. Before we continue to the next section on COVID-19 contact tracing, we would like to test your knowledge. List the 3 basic steps of contact tracing that you have learned today. You have 15 seconds to write the answers in your notebook. Okay, your 15 seconds are up. The 3 basic steps of contact tracing are contact identification, contact listing, and contact follow-up. Did you get all the answers correctly? If yes, well done. Now that you are aware of the 3 basic steps in contact tracing, we will introduce you to COVID-19 contact tracing. Once a case is confirmed, an interview with the patient or the caregiver will be done by the contact tracing team to identify persons exposed to cases of COVID-19. Once we have identified the contacts, we will assess them for infection with COVID-19. After we have assessed the contacts, we will then provide them with the appropriate management. For example, when we do contact tracing for healthcare workers in University of Malaya Medical Center, we need to make sure that the contacts are risk assessed and at the same time identify those who require further management. In contact tracing, it is important to know the meaning of a confirmed COVID-19 case and COVID-19 contacts. A confirmed COVID-19 case is generally defined as a person with laboratory confirmation of infection with the COVID-19. According to Ministry of Health Malaysia, a confirmed case is a person with a positive RTK antigen in predetermined areas or locality with prevalence of COVID-19 more than 10%, or a person alive or dead with a positive molecular test, that is RT-PCR or rapid molecular. A COVID-19 contact is anyone with the following exposures to a COVID-19 case from 2 days before to 40 days after the case's onset of illness. First, the contact is physically present within 1 meter of a COVID-19 case for more than 15 minutes. Second, the contacts have direct physical contact with the COVID-19 case. Third, the contacts provide direct care for patients with COVID-19 disease without proper personal protective equipment. And other definitions as indicated by local risk assessments. Confirmed cases can also present with no symptoms or asymptomatic. These contacts are managed in the same way as for a symptomatic case. However, their exposure period begins 2 days before the case was sampled to 14 days after. Now we shall move on to the 6 steps to investigate COVID-19 cases and tracing their contacts. The first step is introduce. When you call a case, you will introduce yourself and get their basic information. You also want to confirm that you are calling the right person.
Hello, Assalamualaikum. Ini staf nurse Nuraizan ke? Okey, saya Sister Rina daripada Jabatan Kesihatan Awam JKA PPWM. Tujuan saya call adalah untuk membuat contact tracing. Bolehkah kita bercakap? Okey, kita punya interview ni kita ambil masa dalam 15 ke 20 minit. Ya? Okey, saya confirm kembali. Nama staf Nuraizan binti Akmal. Nombor IC 9605. No apa? Siapa dia? Okey, Nur Raiza Akmal binti Muhammad Taha, okey? Okey, sebutkan buah IC boleh?
Next, you want to ask and find out about their infectious period. So you need to ask them questions to be able to determine that.
Perlumbaan swab taken pada 7 hari bulan ya dekat ED, betul ke? Okey, dan keputusan dia bila? Semalam 8 hari bulan 8 ya. Okey. Okey, hari tu ada kata simptom. Simptom ada simptom apa ya? Ada deliberate simptom ke? Okey, simptom demam dan sesama tu pada bila? 6 hari bulan 8 ya, 6 hari 8 hari Jumaat Okey, saya nak tanya, vaksin dah complete ke belum? Dah bila tu? Okey, April 2021 Okey, kat sini last bekerja pada 31 bulan 7 ya. Okey, bekerja sebagai staff nurse di ICU, betul? Okey, saya dapat makluman kemungkinan awak ada exposure daripada housemate ya. Oh, housemate positif pada bila tu? Oh, 1 hari 8. Housemate tu daripada UMMC healthcare worker ke ataupun daripada luar? Daripada luar. Okey, nanti kita go through satu ke satu ya. Okey, saya nak tanya, ada sejarah penyakit lain tak seperti hypertension, darah kencing manis? So far tak ada Okey. Dah berkahwin ke belum? Single. Okey. Tinggal di mana? Okey, Vista Angkasa. Okey.
Once you have figured out their infectious period, you would move on to the next step, whereby you want to identify the contacts they had during their infectious period.
Berapa orang berada dalam Vista Angkasa tu? Ada 7 orang. Okey, 7 orang. Okey, berapa orang berapa bilik air dan berapa bilik tidur? 3. Okey, 3 bilik tidur dan 2 bilik air. Okey. Okey, awak ada share dengan bilik dengan siapa ke? Share room. Okey, roommate. Okey, share room dengan roommate ni apa ni ke? Healthcare worker kita ke? Healthcare worker PPN ke? Okey, tak apa, kita go to satu. Okey, boleh tak dalam 7 orang tu berapa orang healthcare worker? Okey, 2 orang healthcare worker PPM dan selebihnya 5 orang tu daripada luar ya. Okey, awak kenal jugalah 5 orang daripada luar ni, kenal jugalah. Okey. Boleh bagi saya boleh bagi tahu saya healthcare pertama tu, healthcare worker pertama tu, siapa nama dia? Siapa? Raihan. Okey. Dia bertugas di mana? GNS. So far dia ada apa-apa simptom tak? Okey, kejap feeling fever tu bila dia kata? Okey. Lepas tu swab yang first swab tu dia buat bila? 3/8 First swab dia negatif. Lepas tu si Raihan ni second swab on semalam. Hari ni. Hari ni baru dia ambil. Hari ni kes 9 dia baru dia ambil. Result dah keluar dah ke? Okey, result belum lagi, pending lah. Tunggu result dah ni. Dia sekarang under quarantine lagi lah ya? Okey. Dah buat RA dah kat time ada close contact dengan housemate ni? Risk assessment kat portal tu? Dah bila? 1/8 terus buat kan? Lepas tu apa finding dia? Quarantine. Okey, boleh saya tahu yang positif tu siapa nama dia? Hafizan Ismail. Okey, dia bekerja kat mana? Okey, Yon Big. Dekat mana? Yon Big? Big Belly. Okey. Healthcare worker. Healthcare worker Raihan dengan Yula saja duduk kat situ. Lepas tu? Dekat pantai tapi memang dah bulan dah tak balik pun. Lepas tu yang ada housemate tu ada buat swab tak? Housemate yang lain ke? Housemate yang lain. Dah buat swab, housemate yang lain dah buat swab. Finding dia? Keputusan dia? Okey, ada yang positif ke? Dua orang dia lah, Raya Hafizah dengan Yula setakat ni positif. Okey, baik. Saya kan kalau dekat dia orang yang dengan proses positif kan. Lepas tu dia orang macam terkejut. Kenapa kau isi awal sangat? Dia cakap macam saya. Saya cakap lah yang itu motion yang bagi. Dia tak sebab kerja. Betul. Tak apa. Follow je apa instruction by Oshi tu ya. Okey. Masa tu last 31/7 tu kerja apa? 31/7 PM shift. Lepas tu okey, saya nak tanya kebiasaannya pergi kerja naik apa? Naik kereta dan parking di mana? Kat Malaysia ya. Beli ada makan kat time kerja? Okey. Beli makan ke selalu bawa bekal? Grab food. Saya makan yang ada orang provide. Okey, provide ada provide makanan kan? Okey. Makan kat mana? Saya kat pantry ICU ya? Pantry ICU. Okey, selalunya makan seorang ataupun dengan kelik? Seorang je itu. Okey. Kebiasaan ni memang seorang ke makan? Okey, maksimum dekat ICU pantry tu boleh muat berapa orang? Untuk buka pantry saja? Sebab kita orang tak ada meja. Kita orang ada kursi yang pada meja tu. Okey, faham. Okey, faham. Okey, lepas tu selalunya kalau makan berapa lama pula makan dekat dalam pantry tu? Okey, 20 minit. Okey. Jadi time makan on and off lamas kan? Okey. Lepas tu kalau solat dekat mana? Solat dekat yang ICU tu. Tingkat orang keluar. Okey, tingkat 2 surau kat luar tu ya?
Saya sekarang kat ICU.
Oh, okey. Dekat mana? Tak dengar.
ICU kat kereta. Saya ICU COVID.
Oh, IC COVID. Okey. Contohnya kalau solat, seorang ke ataupun ada trip yang lain bersama? Seorang saja Okey. Okey.
Then you would move on to step 4, whereby you will be providing the case with instructions on isolation and helping them to identify issues or challenges in doing so. At the same time, you would also provide them with any support or assistance that you could to allow them to isolate.
Okey, kalau ikutkan kat sini kan, last awak kerja 31, likely infection period awak tu 4 hari bulan. So saya ekstrakan pada saya akan ekstra 1 hari lah 3 bulan 8. Okey. 30/1 PM shift. Lepas tu awak tahu 1 hari bulan 8 awak punya housemate positif. Betul? Okey. Lepas tu awak buat RA semua kan done kan? Okey, dia suruh quarantine kan? Okey, quarantine. So dalam tempoh quarantine awak ada pergi mana-mana tak?
Saya quarantine kat Anjung Penyayang.
Oh, okey, quarantine dekat Anjung Penyayang. Quarantine di Anjung Penyayang sehingga sekarang ke? Oh.
Sebab saya kontak dengan saya lepas dia cakap saya boleh stay kat situ.
Okey. Lagi selamatlah kat situ kan? Okey, maknanya makan semua di-provide lah kan? Okey, so 2 hari bulan 8 still lagi lah si quarantine dekat Anjung Penyayang kan? Betul tak? Sampai sekarang.
Saya datang sini, saya dapat.
Oh, you datang sendiri lah ni kan? Okey. Lepas tu awak start di simptom 68. So maknanya dalam tempoh 1 hari bulan sampai 5 hari bulan awak memang sihat, tak ada apa-apa simptom kan? Cuma just untuk quarantine saja kan?
Saya rasa
macam mana rasa? Oh, rasa letih. Letih tu rasa okey, letih tu ada rasa sejuk kan? Letih. Okey. Itu rasa bila? Rasa letih sangat tu bila?
Dia kasi sudah 3-4 bulan cuma saya tak layan sampai.
Oh, 3 bulan ke? 3 dengan 4 hari 3 dah start rasa macam letih sangat. Sangatnya. Okey, faham. Maknanya rasa letih tu ingatnya letih sebab kerja ke apa kan? Lepas tu 4 bulan pun still lagi rasa letih semua kan? Still boleh control lagi lah kan? Okey. So far dah lepas nak ikutkan dalam laporan interview ni, kita rasa macam tak ada healthcare worker contact. So betul ke? Memang awak tak ada contact dengan healthcare worker lain? Macam pas-pas barang dalam tempoh quarantine semua ke? Tak ada ke? Okey, tak ada. Okey, saya rasa tu saja setakat ni. Sekiranya masih saya buat laporan, ada lagi maklumat tambahan yang saya perlukan lagi, saya call balik atau WhatsApp semula boleh? Boleh. Okey. Okey, setakat ni saja kita punya interview. Saya terima kasih ya. Take care. Okey, Assalamualaikum.
Moving on to step 5, you will then initiate contact tracing, which means contacting the contacts in some way, informing them about their exposure, asking about symptoms, and giving them instructions about quarantine. In step 6, which is the final step, you are going to implement regular follow-ups. And this refers to both contacts as well as the cases, and you are going to check with them throughout their isolation or quarantine period. In order to identify the contacts, a contact tracer is required to conduct a detailed case investigation through interview with the COVID-19 patient or their caregiver. These are some of the questions on movements and activities that can be very helpful in identifying contacts. Then, from the case movement history, the tracer can develop a list of persons who had been in contact with the COVID-19 patient. Next, each contact will be called by phone or in person to determine whether they meet the contact definition and thus require monitoring. In a hospital setting, for example in University Malaya Medical Center, healthcare workers who have been identified as contacts will be notified by the head of departments. These contacts will be asked to fill up the healthcare worker risk assessment form that is available in the hospital staff portal. The assessment will indicate whether the contact is in low, medium or high risk, and the healthcare workers will be asked to either continue working or home quarantine. At the same time, those who require PCR swabs will be asked to do so. Healthcare workers who are categorized as PUS or person under surveillance will have to update their health status daily through the surveillance system. Individuals who have been confirmed as a contact will be provided with info on: number 1, the rationale and steps involved in contact tracing. This includes providing them with information on quarantine. Number 2, they will also be informed about venues for quarantine and how they will be managed. For example, healthcare workers from a hospital setting are given the options to either home quarantine or check in at the hospital's nursing hostel. Number 3, the contacts will also be informed of the symptoms that need to be observed during the monitoring period, example, fever, cough, runny nose, shortness of breath. They also need to be aware of the actions to take if they become unwell, like getting a swab or isolate themselves from others. Contact tracers should also inform the contacts about data protection and why certain personal information must be collected. This is because in the event of a COVID-19 case, relevant personal data can be collected, used, and disclosed without consent during this period to carry out contact tracing and other response measures, as this is necessary to respond to an emergency that threatens the life, health, or safety of other individuals. Organizations, for example the Ministry of Health, may require national identification numbers to accurately identify individuals in the event of a COVID-19 case. So such organizations may collect visitors' IC or passport numbers for this purpose. Organizations that collect such personal data must comply with the Personal Data Protection Act, such as making reasonable security arrangements to protect the personal data in their possession from unauthorized access or disclosure, and ensuring that the personal data is not used for other purposes without consent or authorization under the law. There might be other specific questions or concerns that can be raised by the contact. Therefore, as a contact tracer, you have to update your knowledge on any matters related to COVID-19. When managing and monitoring contacts, it is important to understand and differentiate the terms quarantine and isolation. Quarantine means restricting activities or separating persons who are not ill but who may have been exposed to an infectious agent or disease with the objective of monitoring their symptoms and ensuring the early detection of cases. What it means here basically, persons who have been exposed to a COVID-19 case should try to not have contact with other people except if they need to see a doctor. If the contacts live with other people, they may have to try to find another place to stay or use own bedroom and bathroom. If it cannot be avoided, the person should wear a mask at all times. These practices need to be done for 14 days. Isolation, on the other hand, is separation of ill or infected persons from others to prevent the spread of infection or contamination. Isolation keeps sick people separate from healthy people for the duration of infectiousness, which is 2 days before onset and at least 10 days after onset of illness. It will end when symptoms are improving and the sick person has not had fever within the past 24 hours without using fever-reducing medication like paracetamol. It also means that the cases should try to not have any contact with other people except if they need to see a doctor. If they live with other people, they might try to find another place to stay, and if they can't avoid being around other people, they should wear a mask at all times, and the mask should completely cover their nose and mouth. Daily monitoring of contacts is important to ensure early intervention is given if contacts develop symptoms. Thus, regular communication between the contact tracers and the contacts to monitor for any signs of illness must be done. In the hospital setting, for example, in UMMC, contacts are monitored via a surveillance system. Those who have been identified as PUS, for example, will have to report their symptoms every day via the PPUM staff portal. There are mainly two options for daily monitoring, that is, direct monitoring and self-reporting. Direct monitoring by the contact tracing team involves monitoring for potential signs and symptoms by phone or visiting them in person. However, contact tracers should follow the standard operating procedures such as wearing masks, physical distancing, and hand hygiene. Self-reporting is when contacts self-monitor and report any signs and symptoms to the contact tracing team. Self-reporting should be conducted every day, even if no signs or symptoms are present. In this cyber age, electronic data capture tools should be used wherever possible. Contacts may use applications such as MySejahtera. In MySejahtera, contacts who have been instructed to home quarantine can report their daily symptoms using the home assessment tool HAT. One of the reasons for using these tools is because the number of contacts identified for each COVID-19 case varies widely. For instance, in Taiwan, the average number of contacts is 17 per case. So imagine the number of contacts if there are 1,000 cases reported in a day. Monitoring phase for each contact ends 14 days after the last contact with the COVID-19 patients, or if the contact develops COVID-19. But if the contacts are near to each other and one of them becomes a COVID-19 case, the follow-up period is reset to 14 days after the last exposure to the new case. In certain circumstances, contacts may not be contactable due to various reasons. When this happens and the contact tracers are unable to reach the contacts, they should ask the relatives and friends or use other ways to locate them. Sometimes, the contacts are relocated to known locations within the same catchment area. So if this happens, the contact tracing team should visit them to investigate further and ensure that they are managed accordingly. If the contacts have moved to another catchment area, the responsible contact tracers must be informed so that they can continue the investigation work. It is important to remind the contacts that if they develop symptoms, they need to be self-isolated and follow the SOPs for testing and treatment in their area. In the next section, I will touch briefly on ethics of contact tracing. It is important to note that the case investigations and contact tracing provide a public good because they are going to reduce the risk of public getting COVID-19. Public good means anything that benefits or provide for the well-being of the public, or in other words, it is something that benefits everyone in the society. However, we always must balance this with respect for privacy, autonomy, and confidentiality. Contact tracing is a public health intervention. Therefore, it needs to be balanced in terms of the public good and individual rights. For contact tracing to be able to limit the rights of individuals to privacy or autonomy, it must meet three criteria. First, it must be respectful of individuals and their rights. Second, it must be a benefit to society that is balanced with the limits on individuals. And three, that it must benefit all members of society. In order to ensure these criteria are met, the following practices must be observed by contact tracers. First, contact tracing carries implications both for the confidentiality of the patient diagnosed with an infectious disease and the privacy of individuals the patient identifies as contacts. Thus, every contact tracer has the responsibility to protect the privacy of the patient by restricting disclosure to the minimum necessary information. For example, by not identifying the patients when advising third parties of their exposure. The tracer should also notify the patients that information they provide about contacts will be shared with public health authorities for use in contact tracing to mitigate additional spread of COVID-19 and treat those who have potentially been exposed. Second, contact tracers should also assure cases and contacts that the information will be kept private. So, contacts who are identified will be told that they have been exposed to someone who has COVID-19, but they will not be told who the case is. So, the case can be reassured that if they share who their contacts are, contact tracers are not going to disclose their name to those contacts. Third, the contact tracer can ask about private information only for the purposes of contact tracing, and a contact tracer can use the private information provided only for contact tracing purposes. Contact tracers must also remember that it is the right of an individual to have their personal, identifiable, and medical information kept private and not released without his or her consent. This means medical information cannot be shared with anyone else unless the patient agrees to it. However, COVID-19 test results can be shared to protect the public's health.
Assalamualaikum dan selamat sejahtera. Saya Dr. Mona daripada UMMC Healthcare Worker Surveillance Contact Tracing Team. Boleh saya bercakap dengan Puan Rina?
Waalaikumsalam. Boleh doktor.
Baik Puan, saya nak tanya beberapa soalan ya tentang contact tracing dengan Puan.
Boleh doktor.
Panggilan ini adalah benar dari kami, bukan scam. Perbualan di sini adalah sulit dan confidential, bermakna ianya tidak akan disebarkan dan identiti Puan tidak akan didedahkan sama sekali.
Ya, saya faham.
Perbualan ini akan mengambil masa lebih kurang 15 minit ke 20 minit. Boleh ya Puan?
Boleh doktor.
Baik Puan, saya ambil maklum Puan dan dapati bahawa result swab test COVID-19 Puan adalah positif pada 8 hari bulan 8 2021. Jadi saya perlu melakukan pengesanan atas pergerakan Puan sekiranya terdapat kontak rapat di kalangan sesiapa saja yang Puan berjumpa dalam tempoh 48 jam sebelum Puan bergejala atau mengalami simptom seperti demam, batuk, sesama, sakit tekak, pening kepala dan lain-lain.
Ya betul. Saya disahkan positif pada 8/8. InsyaAllah saya akan beri kerjasama.
Baik. Puan, boleh saya tahu bila Puan mula bergejala atau mengalami simptom seperti demam, batuk, sakit tekak, pening kepala dan lain-lain? Boleh beritahu hari dan tarikh?
Saya mula rasa demam, batuk, sakit tekak pada hari Khamis iaitu 5/8.
Baik. Ini adalah soalan berkenaan dengan tempat kerja Puan ya. Apakah tugas Puan sebenarnya di tempat kerja?
Saya bertugas sebagai jururawat di ward 4UB.
Adakah tugas Puan sentiasa berdepan dengan orang setiap masa?
Saya melaksanakan tugasan kejururawatan kepada pesakit-pesakit COVID di ward 4UB saja.
Adakah ruang tempat kerja sempit sehingga sukar untuk melakukan penjarakan sosial?
So far, ruang tempat kerja saya sangat selesa dan saya tiada masalah untuk membuat penjarakan sosial.
Adakah Puan berjumpa dengan individu bergejala atau mengalami simptom?
Ya, saya hanya terdedah kepada pesakit-pesakit COVID yang bergejala di ward 4UB.
Ini soalan berkenaan dengan kontak rapat di tempat kerja Puan. Di mana tempat atau lokasi terperinci Puan bekerja sepanjang hari sebelum bergejala atau mengalami simptom?
Lokasi saya bekerja sehari sebelum bergejala iaitu pada 4/8. Saya bertugas di ward 4UB, bekerja shift pagi daripada pukul 7 pagi hingga 2 petang.
Dengan siapa Puan bekerja dan berjumpa sepanjang tempoh tersebut?
Saya bekerja bersama staf nurse Alia. Nombor kontak dia 012-390-8062. Staf nurse Amira 017-8062-390. Staf nurse Dahlia 014-332-111. Dan PPK Zita 013 223 1454.
Di mana tempat atau lokasi terperinci Puan bekerja 2 hari sebelum bergejala atau mengalami simptom?
Okey, lokasi saya bekerja 2 hari sebelum bergejala iaitu pada 3 hari bulan 8 saya bekerja shift petang.
Dengan siapa Puan bekerja dan berjumpa sepanjang tempoh tersebut?
Saya bekerja bersama staf Nila. Nombor kontak dia 012 390 802. Staf Nila Zaitun 010 517 2812. Staf Nila Intan 012 232 1454. PK Nur 013 336 2417.
Baik, ini soalan berkenaan dengan kontak rapat Puan. Selain di tempat kerja, Puan ada pergi ke mana-mana, berjumpa atau tinggal dengan sesiapa dalam tempoh 48 jam sebelum bergejala atau mengalami simptom?
Tidak ke mana-mana dan hanya duduk di rumah saja.
Baik Puan, terima kasih banyak-banyak. Sekian saja soalan daripada saya mengenai kontak tracing. Puan ada apa-apa soalan untuk kontak tracing?
So far saya tak ada soalan.
Jika tiada, saya ucapkan terima kasih kepada Puan sebab sudi beri kerjasama dan luangkan masa berkongsi maklumat kontak tracing dengan kami. Pihak kami juga berharap Puan sentiasa menjaga diri dan semoga cepat sembuh dan kembali sihat sejahtera seperti sedia kala. Terima kasih Puan.
Sama-sama.
We have come to the end of this video presentation. Remember, contact tracing is a key strategy for interrupting chains of transmission of SARS-CoV-2 and reducing COVID-19 associated mortality. It is also used to identify and provide supported quarantine to individuals who have been in contact with people who are infected with SARS-CoV-2 and can be used to find a source of infection by identifying settings or events where infection may have occurred, allowing for targeted public health and social measures. I'm Dr. Nik Daliana Nik Farid. Thank you for your attention and have a good day.